Good afternoon, colleagues. My name is Philip Naluande. The title of my presentation is a comparison of effectiveness of Efavirenz and Nevirapine-based first-line HIV treatment on patients attending Comprehensive Care Center in Mombasa. The summary of the finding is that results from this study demonstrated that Efavirenz and Nevirapine-based combinations of highly active antiretroviral therapy were safe, well-tolerated, and effective in increasing CD4 cell counts and suppressing HIV progression in advanced HIV-infected patients. Also, body weight changes and hemoglobin levels increased significantly for both patients in these two treatment regimens after initiation of highly active antiretroviral therapy. Weight gain was also found to have substantial subject variability. Importance of the research is that there is a growing need to assess the effectiveness of antiretroviral therapy through monitoring of immunological and biochemical parameters and justification on the use of Efavirenz and Nevirapine-based regimens as first-line HIV treatment for adults in Kenya. Also, there is very few data which exist on efficacious regimen strategies to manage HIV/AIDS in infected adults in Kenya, and also safe alternatives are not currently a viable option for many, including infected patients in sub-Saharan Africa, and Kenya is not excluded due to the fact that a majority of ARVs which are available in our public health settings are donated from foreign donors. It is also important to identify interventions that will decrease morbidity and mortality among our patient populations. According to Global Fund report issued by UNAIDS, more than 38 million people have been infected with HIV and 25 million people have died of AIDS-related illness worldwide. And over 95% of all HIV-infected people globally are from developing world, with sub-Saharan Africa alone accounting to over 32% of those infected. Therefore, the number of people living with HIV in Kenya includes about 1.6 million adults between 15 and 49 years, and another 60,000 aged 50 years and over. Indeed, results from the Kenya Demographic Health Surveillance indicate that approximately 7% of Kenyan adults are infected with HIV, and in coastal region where the study was conducted, Mombasa County has a higher adult HIV prevalence of 11.1% based on Kenya AIDS Progress Report, while other counties had a lower percentage of below 6%. Antiretroviral therapy, as we know it, has improved the life of patients living with HIV/AIDS infection, but has similarly been associated with elevated liver enzymes. It is also important to monitor liver function and renal function tests of patients on heart. And we know that prolonged utilization of some antiretroviral drugs in patients infected by HIV can lead to the outbreak of lipodystrophy syndrome. When administered on a long-term basis, heart regimen containing stavudine may result in hyperlipidemia, insulin-resistant and fat malabsorption, increasing the risk of coronary heart disease. In a study in Western India, the prevalence of lipodystrophy was reported as 46.1%, and all was associated with stavudine use. The study design, this was a prospective comparative study of Efavirenz and Nevirapine-based HIV regimen given randomly to HIV-infected adults eligible for highly active antiretroviral therapy at Provincial General Hospital and followed up for a period of 12 months. Screening of patients for eligibility was done at the Comprehensive Care Center after patients were referred from VCT clinics, outpatient clinics, and the wards. At baseline, patients were physically examined and tested for HIV, liver enzyme, in particular ALT, serum creatinine, hemoglobin, and CD4 cell count. At enrollment, every patient who tested positive for HIV and had a CD4 count less than 350 cells per microliter with a normal renal and liver function test was enrolled into the study. Random sampling was used to select patients who were allocated to either Efavirenz or Nevirapine-based therapy and followed up for a period of 12 months until the sample size of 200 patients was achieved. Clinical assessments were also done to check for medication adherence and adverse events. The results of this study showed that there were no differences in indicators of socioeconomic status, such as age and sex, among the different outcome groups. The majority of the patients were in the age group of 29 to 39 years, whereas the smallest number of patients were in the age group of 51 to 60 years. 49% of the study group were males and 51% were females. The analysis of patients' weight from the time of enrollment 0 months up to 12 months showed that there was no significant difference for patients randomized in either of the two groups of treatment, basically Nevirapine and Efavirenz, with a p-value of greater than 0.05. The means of CD4 cell counts for patients in the study showed that there was significant difference from the 6th month of enrollment to the 12 months of treatment for patients who are on Efavirenz compared with those with Nevirapine, with a p-value of 0.001 showing significant difference. The analysis of hemoglobin showed that there was no significant difference between the two treatment groups, patients who are either on Efavirenz or on Nevirapine, with a p-value of 0.42, which was not significant. Analysis of the means of liver enzymes for the patients who are enrolled on this study for the full period of ART use showed that there was also no significant difference in terms of ALT enzymes for both patients who are randomized in these two treatment groups. The p-value was 0.6, showing there was no significant difference in these two groups. However, the analysis of creatinine levels for patients who are both on Efavirenz and Nevirapine showed that between these two groups, there was significant difference between the two groups with a p-value of less than 0.001, showing that there's significant between patients who are on Efavirenz with those who are on Nevirapine. Conclusions: the study findings show that anemia is a frequent complication of HIV/AIDS infection, and severity depended on the clinical and immunological stage of the disease, worsening in patients with opportunistic infections, low CD4 count, and low body mass index. Efavirenz regimen was also a superior regimen compared to Nevirapine in terms of renal function. There was also no significant difference, as I had mentioned earlier, observed in the liver function for the two treatment groups. Future recommendation and steps: HIV patients on HART, highly active antiretroviral therapy, should have CD4 cell count monitored regularly before and after commencement of HART in the absence of viral load testing. Efforts should also be made to maximize HART accessibility, adherence, and tolerability to patients who require HART so as to minimize the number of patients switching therapy or withdrawing from these important life-saving programs. This study showed that early start of HART may prevent anemia or its severity. Therefore, a wider study that includes several HART regimens and a long-term follow-up is recommended. Thank you.